Thank you, Janine, and welcome to this morning's webinar, Assessing Health and Safety Risks in Uncertain Times. I'm Sharon Kearns, Risk Consultant with Zurich Municipal, insurer and risk management service provider to the public sector organisations, including charities of all sizes and services. I'm delighted to be bringing this webinar to you in partnership with the NCVO, the National Council of Voluntary Organisations, an organisation which has championed the voluntary sector and voluntary movement since 1919, and today connects, represents and supports over 15,000 member organisations, from the smallest community groups to the largest charities. As Janine says, we have a couple of polls using Slido within the webinar this morning, and if we have sufficient time, we have some pre-submitted questions and answers to share. We'll be sending out the slides to delegates after the webinar, and within the deck are a range of resources to assist with risk assessing during this COVID-19 epidemic. So, getting started, the objectives for this morning are getting you to think about the key health and safety risks within your charity, the advantages of implementing risk assessments, defining the hierarchy of risk controls, and highlighting the importance of being able to demonstrate that a hierarchy of controls has been considered and implemented. Lastly, highlighting how a formalised risk-based and risk assessment-based approach can assist in liability defence, both statutory compliance and compensation claims for negligence. Firstly, though, a reminder that the Charity Commission for England and Wales has produced guidance on risk management for the charity sector, CC 26. This provides a risk management model following the HSE guidance and Zurich Municipal's approach to risk management and risk assessment, the Plan, Do, Check, Act a model. The NCVO would also like me to signpost you to their risk register template, which includes useful references in the slides. The risk management model within CC 26 advocates establishing a risk policy, identifying risks, assessing risks, evaluating what actions need to be taken on risks, and periodic monitoring and assessment. The session this morning will concentrate on the risk assessment aspect of the model from a health and safety perspective, and with particular reference to the impact of coronavirus and COVID-19. I think we might be having some problems with the slide deck. Let's carry on. Apologies. So let's start with a refresher on why you would carry out health and safety risk assessments. Three main reasons. Firstly, from a moral perspective, first and foremost, to prevent accidents and ill health associated with the workplace and service activities, and identify if you're doing enough to protect your charity's employees, third parties and service users. Secondly, from a legal perspective, legal reasons to carry out risk assessments to comply with statutory and civil law, so as to avoid prosecution potentially by the Health and Safety Executive, and claims for compensation for damages from persons suffering loss in connection with your activities, so injury or ill health. In terms of statute, the key legislation is the Health and Safety at Work Act, with the Management of Health and Safety at Work regulations being the key risk assessment specific requirement, and then a plethora of legislation that links with the requirement for risk assessment. The legislation is enforced in the main by the Health and Safety Executive, and non-compliance can result in prosecutions, fines or imprisonment for non-compliance. And it must be remembered that you cannot insure against fines for non-compliance. In terms of civil law, we have a common law duty of care owed to others, and an injured party, a plaintiff, may sue an employer or service provider for damages or losses due to lack of care owed. And a plaintiff can also refer to requirements of statutory requirements within their claim. These are commonly referred to as compensation claims, and risk assessments are always key to claims, compensation claims investigations. Within the charity sector, trustees are obviously legally obliged to manage safety, and it's very important that you can demonstrate to your trustees that compliance is in place. And finally, but not least, financial reasons, and directly linked with legal provisions, are prosecution fines and legal costs and compensation claims. We've seen since 2016, we've seen a seismic increase in fines issued by courts following HSE prosecutions. So the average fine has risen from £70,000 to over £200,000, with a significant number of fines in the public sector exceeding £1 million. And of course, that doesn't include compensation claims. The not so obvious costs in terms of accident, ill health, inevitably leads to downtime, significant investigation time, staff replacement, lost business, lost reputation, etc., and potentially for charity sector, potential loss of funding. And in fact, approximately 80% of risks faced by organisations are not insurable. So whilst I work for an insurance company, I do have to advise you that insurance covers only the tip of the iceberg in terms of accident and ill health costs. Headline news tends to illustrate the moral and legal financial reasons to risk assess quite nicely. A few examples here. The first example was an example of an operative using hand sanitizer to clean his hands in a workplace, very apt at the moment. And this was recently publicised as a health and safety alert in LinkedIn. The work was carried out in an environment with the potential to produce static electricity. A spark was created and the operative's hands caught alight. Obviously a lacking in cost risk assessment there. The second example, which hopefully when the slides catch up, you'll be able to see, this is an example of a sheltered housing scheme suffering Legionnaire's disease and a number of residents coming down with the disease due to a failure in the Legionella risk assessment, and this was followed by a prosecution by the Health and Safety Executive. The third example, we have a fatal tower block fine for a local authority in which 6 people were killed, and that the fire risk assessment was found to be inadequate. And the last example, which hopefully when the slides catch up you'll be able to see, is a fine for Birmingham City Council for inadequate tree risk management, which led to the death of 2 people and subsequently resulted in a large health and safety prosecution and obviously reputational damage there. So just a few examples of tragic circumstances and damaging headlines associated with the lack of or inadequate risk assessment. And then there's the compensation claims. Zurich is an insurance company, so obviously we tend to focus on claims outcomes, claims trends, and what can be learned from claims. But the risk assessment process to prevent injury or ill health and evidence required to defend claims for compensation are the same as if you were proposing to defend a health and safety executive investigation. In the first case, we have an organisation responsible for a community centre, and in this case an unfortunate member of the public suffered significant burns after sitting on a toilet seat in the community centre, which had recently been cleaned with a concentrated solution of cleaning product. The organisation responsible was found liable for lack of cost risk assessment, and just under £59,000 was awarded to the injured party. The cleaning products required dilution, so that was a simple resolution to that. In the second case, we have just over £88,000, £88,500 compensation awarded to a night support worker who sustained injuries following a fall downstairs while carrying a laundry basket. And in this case, the organisation was found liable for not having a suitable or sufficient risk assessment in place. The risk assessment didn't refer to the routine transporting of items up and down the stairs. Incorrect equipment was provided for the task in terms of a laundry basket, which required holding the basket with 2 hands, and laundry baskets were very quickly replaced with laundry bags. So in both cases, the courts deemed that the risk of injury was both foreseeable, and simple solutions could have reduced the risk of injury, and quite substantial compensation claims paid to the injured parties, and quite rightly. So we've refreshed why carry out health and safety risk assessment, but what is a risk assessment? So in terms of the health and safety executive definition, it's a risk assessment is a systematic examination of a work activity undertaking, premises area, equipment, service provision, etc. Anything which is under your undertaking, really. And in other words, it's a careful examination of what in your work could cause people harm, and also so that you can weigh up whether you've taken enough precautions or you should do more to prevent them. Risk assessment should identify all significant risks to safety and health of employees and non-employees, so that's covering members of the public, volunteers, contractors, service users, etc., to whom the duty is owed under the Health and Safety at Work Act, management regs, and any of the other subordinate regulations. It must be carried out by a competent person. Risk assessments must be carried out by a competent person, but what does that mean? In simple terms, it's a person with enough knowledge and experience to be able to perform the task of risk assessing effectively, which means they must have enough experience, but they must also have enough information, instruction and training in both legal requirements, the charities' own protocols and processes and databases, etc., for carrying out that task. So, a question for your organisation, and hopefully we've caught up with the slides. Yes, we have. Have you formally identified the competent health and safety risk assessors in your organisation? And if you could go to Slido to vote now, yes or no, and in a few moments we should take the results. The results may take a few seconds. That's very, very reassuring. We have 100% response in terms of identifying your competent health and safety risk assessors in your organisation. Oh, we're changing. We've now gone down to 67% in terms of yes, we have formally identified risk assessors. We're changing. Don't go too soon is the lesson. Thank you for voting. I think we'll close the vote now. 5, 4, 3, 2, 1. We have an 80-20 split. So we have 80% of delegates on the line saying they have formally identified risk assessors, and 20% saying we haven't formally identified risk assessors. So obviously in terms of the 20%, it's making sure you do find out who they are. If you have competent risk assessors, whether you've provided the appropriate level of information, instruction and training in carrying out risk assessments for your charity and the various functions it holds, and particularly relevant with regards to the current COVID-19 epidemic, are risk assessors competent to encompass the relevant parameters of COVID within the risk assessment. So thank you for voting. So we've covered the why and the what is risk assessment, now the how to risk assess. In essence, we cover the 5 steps to risk assessment, health and safety risk assessment as advocated by the Health and Safety Executive, and also a CC26 Charity Commission Risk Management Guide for charities. So on the left of the screen, you can see the simple 5 steps. So identifying all hazards, all significant hazards within the work and services provided, and the service provided is probably bigger in some respects for public sector and in particular charity services. Identify who might be harmed, so the whole workforce, members of the public, volunteers, contractors, partners, agency staff, delivery drivers, vulnerable people, and vulnerable people has a new meaning really in terms of the current situation with COVID-19, young and expectant mothers, etc. Evaluate the risks and the controls. So what are you already doing to control the risks in the workplace and within the services that you provide? What further action do you need to take over and above what's already in place? What more do you need to do? Record, communicate and retain. So it's very, very important from an evidence perspective that you do record, communicate and retain the findings of your risk assessments and any safe working procedures coming out of the risk assessments. Who needs to carry out the actions, who's responsible for ensuring that safe systems of work are in place and actually implemented. Considering when they should be implemented, any controls, and this might be over a period of time or immediately, depending on the level of risk. Monitoring and reviewing, finally, making sure any safe systems identified are actually implemented and you record those systems of monitoring. That is a requirement of the management of health and safety at work regulations, and review the whole process as work practices change, the change to guidance, accidents, ill health, hindsight and as good practice periodically, and of course at the moment reviewing risk assessments more frequently due to the changing nature of COVID-19 in the workplace. Also, in terms of the requirement of the management of health and safety at work regulation is that the hierarchy of control. If we just move back a slide, please. Thank you. In terms of the hierarchy of control, this is an expectation of the management regs that the most effective to the least effective controls be considered and implemented. Starting with the most efficient, eliminating the risk. So, for example, treating slippery surfaces or steps rather than erecting a slippery surface sign. Substitution, using a less hazardous cleaning chemical, perhaps. Engineering controls, so perhaps providing guarding or physical protection. Moving down to administrative controls. So this is changing the work practice to reduce exposure to hazard, adapting the work to reduce the risk, providing all relevant information, instruction, training and supervision to implement the safe systems of work. And lastly, in terms of personal protective equipment provision, ensuring that the PPE is appropriate and used, it's maintained, it's cleaned appropriately, and that it's replaced. And of course, that's a contentious issue at the moment during the current COVID epidemic. Welfare facilities also come within that remit in terms of housekeeping, hygiene and cleaning regimes, which is also obviously a big process for preventing infection spread at the moment. And in going through the hierarchy of controls, you hopefully will be able to demonstrate that you've reduced the risk as far as reasonably practicable. And in fact, you are likely to be implementing a combination of the hierarchy of controls. So that's the general process for risk assessment. Moving on to the new risk provided by COVID-19. The risk is obviously not produced in the workplace, but it must be managed in the workplace. So how are you expected to approach the new hazard? Excuse me. Hopefully it's reassuring to you that you must go through the same process as pre-COVID. So utilising the 5 steps to risk assessment and the hierarchy of controls. So in terms of the 5 steps, identifying the hazard, well, that's coronavirus and COVID-19 disease. Is elimination possible? not likely, or can we, I suppose, in terms of do we carry out the work or provide the service or not? Substitution, that's not a possible. Where and how your work services are carried out. Can engineering controls be implemented, physical barriers? In terms of a simple example, we've seen barriers within supermarket checkouts, etc. That may or may not be an option for the charity you manage. Can jobs or services be changed to reduce the risk of infection and infection spread? Who might be harmed, so protecting people who are at higher risk. Again, considering the whole workforce and the traditionally vulnerable people, members of the public, etc. But how could the health and safety of these groups be affected by changes in the work of your charity as a result of COVID-19? What are you already doing to control the risks? So what have you implemented so far? If you have had a phased return to providing services and work, are your control measures impacted by shortages of supplies, staff and contract services? What further action do you need to take? So over and above what is already in place, what do you need to do? Anything from, in terms of social distancing, moving desks to meet the 2-metre rule, staggering break times, restricting entry to public, installing more welfare facilities, shifts, cleaning regimes, because to identifying touch points, etc., and decontaminating surfaces. Who needs to carry out the actions? Obviously, in terms of information, instruction and training around the infection risk. When these actions should be implemented, before work resumes, before service provision resumes. Can you have a phased introduction? Have you recorded, communicated the safe working procedures? And key again, have you provided relevant information, instruction and training on the hazards and the risk controls? And leading on from the risk assessment, implementing the higher order controls through safe systems of work. So can the work be carried out from home? Can travel to a job be carried out whilst observing social distancing rules? Can tasks be carried out safely? Can normal and emergency operations continue safely with less staff at work, potentially due to illness or family illness? Do you still have the required skills, or are key skills absent? Can you provide the required PPE to continue a specific task? And as I mentioned, obviously that's a contentious issue at the moment. Long hours of work will fatigue impact on the services that you provide. In terms of formalising your systems, making sure that you record the risk assessments and the safe working procedures to be able to evidence that you have considered and done all that is reasonable and safe systems of work are in place. The assessment should identify all significant and foreseeable risks arising from work activities and their undertaking. So identify and consider guidance, particularly for people particularly vulnerable to the virus, pregnant workers, those beyond typical retirement age, those with underlying health conditions, etc. Taking into account a reduced workforce, and obviously adhering to Public Health England, Health and Safety Executive and government regulations and advice. Also considering your codes of practice for your business sector, your charity sector as well. There is lots of information on the Health and Safety and .gov websites. Zurich have also produced a number of risk insights. The Institute of Occupational Safety and Health have also produced a raft of information with regards to returning to work and the impact of COVID in the workplace. And we've included lots of these links within the slide deck, which will come out to you later today. In terms of a positive note, as always, risk assessment should not be overcomplicated. Overcomplicating a risk assessment is likely to result in it not being used or shortcuts taken. So it's about being simple and safe, and it allows flexibility in terms of you are determining what your own safe system is. Ultimately, from a legal perspective, suitable and sufficient is open to interpretation, but as long as you can demonstrate that you have what you have done and why, the references you've made to all the relevant guidance, and that you've determined the risk is tolerable, it is difficult to argue that you have not taken suitable and sufficient measures. Some examples of employee activities to consider in the new norm. So this is not an exhaustive list, and I ask you to consider what are the significant risks in your organisation. And of course, we're all preoccupied with COVID-19, but we mustn't forget the conventional pre-COVID risks associated with work and services provided. So such things as manual handling, lone working, use of equipment, and whether these risks are actually increased as a result of potential COVID infection. For example, cleaning and cleaning chemicals, what you need to use, and cleaning regimes. And obviously we had the example earlier in terms of alcohol-based hand washes, etc. I doubt many of you will be working in environments of static electricity, but it's to be considered. Caretaking, what are your caretakers doing? What do they need to do? Do they have any additional tasks, and therefore risk assessing for them? Lone working, and perhaps starting lone work from home, so leaving home and providing services in the community perhaps, or a community centre. What are the systems for emergency backup, for example? Is it still safe to carry out lone working? Is lone working safe in itself in terms of 2 metre distance? That's the question. Use of equipment potentially, so in terms of equipment per individual, or is equipment needed to be shared, and how is that equipment to be cleaned in between, etc. And of course we mustn't forget the mental health and well-being aspect of the changes to the work that people are expected to carry out, and the general impact of COVID on the community at large anyway. Also in terms of tasks being carried out by redeployed staff, so staff may be working differently, they might be providing a different service, carrying out different tasks. So again, it's vital that the appropriate information, instruction and training is provided to ensure they're competent and comfortable to carry out any new task. In terms of non-employee based examples, we've listed a few here. So service activities to consider in the new norm. So the activities or actions of employees on service users, the activities and actions of volunteers, exactly the same health and safety legislation applies. Actions of third parties, so that might be your contractors. What are you expecting them to do differently perhaps? Are you contracting some of your work out? And also, are you working alongside agencies? Lots of charities do work as a sort of multi-agency approach. So are your safe systems of work compatible? Have you identified risks to working together? Changes to services delivered, and that might be services that you're contractually bound to, or grant funded services. And in terms of any events, most organised events, as our event today, would have been a face-to-face training session. We're changing the way we do things. So again, what are you doing and how are you doing it? Potential liabilities associated with assets still need to be managed. So we might have a range of closed buildings and facilities secured. We might be using temporary use of buildings. We have to think about reopening of buildings and facilities, and In terms of statutory requirements, the requirement for statutory examinations is still a legal requirement, and it's not diminished by the COVID-19 outbreak. Examinations must still be carried out by a competent person in accordance with the scheme of inspection, and in terms of the examples I've given here, lifting equipment, pressure systems, Legionella, there's usually a 6 or 12 months inspection period. So in terms of having that competent person available, that may be an issue. In terms of key inspections, some engineering inspections are still being carried out. That might not be the case for you, but under certain circumstances, with the agreement of a suitable competent person, some legislation does allow thorough examination or statutory inspections to be postponed to a later date. But even if such options are taken, if the inspection can't take place, it still remains the duty holder's responsibility to ensure that the equipment or the water system or whatever the statutory piece of equipment is that needs examination must still be safe to use. So again, that falls back to the risk assessment requirement and the hierarchy of controls. Do you take that piece of kit out of action? Is that possible? Can you ensure that the water system is clean in another way? Can you cordon off a particular piece of lifting equipment, for example? Not always possible, but in terms of doing what's reasonable, it's about consulting with the competent person, risk assessing, and making sure that you keep records of your risk-based decision. And in terms of statutory examinations, the Health and Safety Executive has stated that it's not considering issuing exemptions or relaxations of the requirements, but it does recognise that this is a fluid situation and this position is constantly under review. So it's thinking about getting back to normal, getting back to some sort of normal. What are the risks associated with the buildings, the assets, the equipment that you have and are responsible for? So in terms of risks that you consider to be the main risks associated with the new normal, we have a second poll. So in your organisation, what do you consider to be the main risk associated with the new normal? The options suggested by NCVO are funding, employee/volunteer safety, continuity of service provision, and legal compliance. So in your organisation, what do you consider to be the main risk associated with the new normal? Is it funding, employee or /volunteer safety, continuity of service provision, or legal compliance? So again, let's take a few moments to review the votes coming in, and I won't jump in too early this time. I'm wondering if you're finding the results through the poll surprising or as expected. The votes are coming in nicely. So in your organisation, what do you consider to be the main risk associated with the new norm? The options were funding, employee/volunteer safety, continuity of service provision, or legal compliance. I think the numbers are pretty much there. So in terms of funding, we have, it's fluctuating again. Legal compliance is a solid 0%. That's not changed. So the winner, if you like, with this poll, employee/volunteer safety comes in at 70%, and funding, continuity of service provision comes in second at 16%, and funding comes in at 14%. So that's quite outstandingly concerns about employee / volunteer safety and the main risks. So yeah, very up to date. And just to let you know that the poll results will be included within the slide deck coming out later as well. So thank you for voting. So with all of this in mind, how does the virus threat change risk assessments? Well, the process and requirements for risk assessment are the same, but you're likely to be reviewing risk assessments more frequently in line with the changing epidemic situation, government, HSE, Public Health England and charity sector guidelines. So when doing something different, for example, stopping, limiting or altering the service or the way the service is delivered, for example, redeployment of workers, redeployment of volunteers, it's vital that you provide and document the justification for the decision. It's important that you can demonstrate that you've done what's reasonable, demonstrate that the new reviewed and risk assessments, training, induction, supervision, appropriate equipment, etc. have been considered, provided, and that the safety system is recorded and evidenced. So in terms of the guidance from the Deputy Coroner of Birmingham recently provided guidance in terms of COVID-19 risk assessments should be undertaken. The generalised COVID-19 policies and safe working procedures should be in place. Contemporaneous and detailed records should be made in support of decisions taken, which is the advice we've given throughout this morning. And with a conclusion that the stance adopted is reasonable, if the stance adopted is a reasonable one and can be supported evidentially, that the risk of finding of neglect should be minimal. So that's in terms of civil liability. The Deputy Coroner of Birmingham recently giving a view. Obviously, in terms of how that will pan out, we will have to wait and see. So the legal requirements to provide a safe place of work, systems of work and services by carrying out risk assessments are the same. The challenge obviously is the rapidly changing environment, along with changes in government, Public Health England, HSE and any charity guidance, which means for you more reasons to frequently review risk assessments. And so the key messages to take away from this morning are to review your existing risk assessments and obviously complete risk assessments for new or changed practices, be they in work practices or service provision. Review the controls and safe systems in place in the wake of COVID-19. Confirm that controls reduce the likelihood of the risk occurring or mitigating its impact, ensuring that risk assessments, controls, safe systems of work are recorded and retained. And a key message here is don't overwrite risk assessments, don't overwrite any safe systems of work, but ensure you have a timeline of actions taken at particular and in a particular environment, a particular point at which guidance was current, and that will demonstrate you have reviewed and moved with the guidance. Monitor the implementation of the safe systems of work, so you must be seen to check that safe systems are being carried out, and ultimately review that the whole risk assessment process to ensure that it remains current and as I've repeated, in line with Government, Public Health England and HSE guidance. And we would say just bear in mind constantly and question yourself, would it be reasonably practicable to do more, taking into the account the circumstances of your services and COVID-19, because that will ultimately be the question that would be raised by the Health and Safety Executive or a civil court. We have a few minutes for questions and answers, so thank you for your submissions. We have more than we have time to answer, actually, so I've selected what I hope is a good representation of your questions. The questions and answers will be distributed with the slide deck following the session. So in terms of questions, we'll kick off with this one. Are there any useful templates that we can use and adopt when conducting risk assessments? Well, yes, there are. There are general risk assessment guidance. There's the HSC 5 steps to risk assessment, which is on the HSC website, which talks about the general protocols and the hierarchy of controls. There's also the HSC Simple Health and Safety Risk Index, which is also useful. We have Zurich's website, on Zurich's website, the local community advisory service guide, which is produced for town and parish councils and charities, and it was produced pre-COVID, but it does have a lot of template risk assessments, checklists and guidance with regards to risk assessment. And as I say, the protocol is the same. The NCVO have a number of resource tools, and all of these I'm listing will be in the slide deck, which comes out. The links will be within there. And recently, Zurich have also released zurich.co.uk business/coronavirus risk management link, which is very useful and gives guidance on return to work arrangements. Second question, I manage the volunteer programme for a national charity supporting vulnerable adults and young people. 95% of our 100 volunteers have been told to take a break during the pandemic. The few remaining are supporting our service users by phone. We want to look to safely bring volunteers back when lockdown is lifted. What do I need to be mindful of when considering bringing volunteers back on site during the pandemic? We have specific policies and guidance for employees, but I want to know if I can apply the same to volunteers or if we need to think about risks and volunteers differently. Well, that's great that you have specific policy and guidance in place for employees, so that's brilliant. Under the health and safety legislation, volunteers must be afforded the same level of protection as employees. So the same level of protection will mean the risk assessment requirements, safe work systems of work, information, instruction and training. They may need more information, instruction and training, as volunteers tend to be less constant with an organisation. They may not be have been with you for so long, so it's taken into consideration perhaps their not just the training but their lack of experience, so they may need additional information, instruction and training, but the requirements to afford the protection are exactly the same. Think about what the activity is. Are they doing something differently to your employees? Would they need more supervision perhaps, again because they have less experience in the role? But that would be the same for any new employee. So again, it's applying a very similar approach, and referring to government and HSC and Public Health England guidance. And again, the key is to record all that you're doing for volunteers in the same way that you are for employees. If you're doing exactly the same, then the same record. Next question. So a key risk for volunteer driving schemes is the close proximity of a passenger, even in the back seat, as it seems so difficult for small organisations to purchase masks. Is simply questioning the passenger about their own exposure to COVID-19 enough? By definition, the people we are transporting are often the most dependent and likely to have carers in daily. They cannot really know the level of risk they are exposed to through that. So in terms of the volunteers, again, the same level of protection is required under health and safety legislation. And as such, you won't be surprised to know that a risk assessment needs to be carried out. And the SAFE system may have considered some of the following. Can a barrier be provided? Can social distancing be achieved? Is PPE available? Can the car be cleaned between passengers? Can the PPE provided be available, used, replaced? Is the health status of the passenger known, etc.? So the outcome of the risk assessment, the suitable and sufficient risk assessment, together with the SAFE system of work as has been applied through the hierarchy of controls, should leave you with a residual risk that is tolerable. If it doesn't leave you with a tolerable risk, then the service should not be provided. So you need to go through those stages, and if there is still a foreseeable risk of infection, then perhaps you should be looking at and also considering government guidance, Public Health England HSE guidance. Then you need to be thinking, we need to go through the risk assessment again. Can we do more? How many minutes do we have? A couple more minutes. We are the umbrella body for a network of service delivery organisations providing support to unpaid carers across the UK. Many small/medium-sized charities have had a fairly static approach to risk management. What advice or organisational development or frameworks would you suggest to improve the understanding of responsive risk-based decisions making, given the COVID-19 environment is so dynamic? The overarching advice would be, don't be static at this time. Obviously, the COVID-19 situation and the environment in terms of government guidance is changing frequently. That might be difficult if you've not got access to competent advice, a competent health and safety officer perhaps, or someone you can get risk management advice from, but look to obtaining information from all of the relevant sector guidance, HSE guidance, government guidance, etc. Ultimately, the pandemic impacts all, and all employers and service providers are expected to respond and react on their health and safety arrangements. So it would be in line with previous responses and the content of this webinar to review existing risk assessments, provide new risk assessments for new processes, services, work activities, and provide information to those carers, provide sufficient information, instruction and training that carers are able to carry out dynamic risk assessments. Last question. Should we have a separate risk register and risk assessment specifically for COVID-19? Our risk register was recently updated, reviewed, and it did not take into account a COVID-19 pandemic. Well, the strategic risk register should refer to and consider pandemic risk. Operational risks associated with the work and services should be reviewed. So that would be your health and safety risks underneath that. So reviewing again, risk assessment, safe working procedures, information, instruction, training. So again, the general response from the previous questions and also the context of this webinar. We're running out of time slightly, so before we bring the webinar to a close, I have a request on behalf of the NCVO. If you could please complete the form on the attached link, the first link within this slide on display at the moment. They would very much appreciate that. That's NCVO is collecting information about how a lockdown will affect charities. So if you could please complete that and submit that to the NCVO. And the NCVO have also kindly provided a link to their resource tools and risk register templates. And finally, attached are a number of very useful sites I think will assist you with risk assessing the diverse range of work activities and services provided by the charity sector. Hopefully you'll find those very useful. So that concludes our webinar for this morning. I hope you found it useful. Your feedback is very much welcomed. We're sending out a survey to follow along with the presentation slides. Apologies for the slight glitch at the beginning with the slides, the technology problems, and thank you very much. Thank you.